Given the situation that we face and your experience not only as a commissioner, but also in following the workings of this committee, what advice do you have for us?
You're focused on what's the impact on caseloads. Can you leverage the funds in programs that work? I'd invest on the front end of the system. I mean, I truly believe that's where the investment needs to be. I think you've got great leadership in the agencies. I mean, Commissioner Cease, Commissioner Lichtenstein, Commissioner Traylor. I mean, those folks know what they're doing and they're best positioned to guide you. But invest on the front end of the system. I mean, it's like this case with this woman. If she had carried through on that abuse, the state would have been looking at putting her in a prison system and paying all the costs of that, and they would have looked at providing care for that child for the rest of that child's life. I mean, why do we want to do that? I mean, it just makes sense to put it on the front end of the system. And frankly, if you got to pay more, I'm willing to pay more. I don't care if you call it a fee, you call it a tax, I'll pay it, because I think it's an investment that's worth time and effort to do it.
I came to the Capitol today to discuss the issue around there's a class waiver program, and the waiver program provides assistance to children that are medically needy, medically fragile, that live in the community usually with their parents. Our son Nolan, who's 9 years old, he has autism, he's legally blind. It's all the difference. Because if you take a kid like Nolan, if you hadn't gotten him the physical therapy or whatnot, whatever it is a child needs, and then as an adult they're still in a wheelchair, they're going to cost so much more because they got to be transported, they got to have a lift, they have to have all that stuff as an adult, and that's going to end up falling on Texas later because he'll be out of the home setting. So it definitely costs more later if you don't address it immediately. It's ages 0 to 3 and sometimes further.